I'm Jonathan Handel. I'm an entertainment and technology attorney, and I'm also an entertainment journalist. In addition to that, I have a background in tech. I've brought all those skills together to try to help you, SAG-AFTRA member, navigate your options under the new healthcare plan. What I've done is created an interactive healthcare advisory app. In other words, an interactive questionnaire. And I'd like to show you how to use it in this self-taped video. And I hope you'll forgive if there's any awkwardness in the self-tape, since it's one of the first times that I've done a self-tape. I'm sure it's not your first time. What I'm going to be doing is showing you the process of going through the app. What you'll see is that there's a question or two and then a number of informational screens. Then we get into heavy-duty Q&A, where we ask about your age, your earnings, your days of service, things of that sort, and sometimes even more intricate kinds of questions along those lines. Were you born before such and such a date or not? All of this is an attempt to find you the best possible coverage options under the healthcare changes. I want you to know I'm not responsible for those changes. I don't work for the plan, that is to say the SAG-AFTRA health plan. I don't work for the union. I am maybe an outside agitator. I hope I'm an outside informer. And I know that there are a lot of members that are very upset, very nervous, very concerned and afraid. The health plan has had changes over the years. This is perhaps one of the most disconcerting for people, and I understand that. What I've tried to do is help you navigate and understand the best options for you personally under the circumstances. With that in mind, let's go through the app. So I'm going to start by sharing my screen. And I think this is, I should have this right. Okay, share screen, there we go. All right, so what we're looking at is a blank browser window. I use Firefox, but you can use Safari. You should be able to at least let me know, and I'll tell you how to send me feedback. Let me know if you have a problem with a particular browser, but this should work on any modern browser: Safari, Chrome, Firefox, Microsoft Edge, whatever it is that the unnamed browsers on Android, whatever it is that you use. It probably, by the way, speaking of Android, probably works better on a PC or laptop than on a phone, but it does look like it worked. I've tested it out. It does seem like it'll work on an Android or presumably an Apple phone as well, or a tablet for that matter. So let's go to SAHP, stands for SAG-AFTRA Health Plan, you can see I filled it in from here already, but I've been there, .app, which stands for app. Well, it says app. SAHP, SAG-AFTRA Health Plan, SAHP.app. Now, by the way, and we'll hit return. It goes to a Google Doc, as you can see, a Google form. If you want to email a friend and tell them where they can go, meaning the app, not where they can go, you'll want to type to your friend or Twitter or whatever, or Facebook if you're posting it, you'll want to type https://sahp.app. That's because even though the browser recognizes this as an address, because you're typing it in the browser entry, email programs will not recognize a .app automatically. So anyway, that's just a little bit of extra, unnecessary extra perhaps. So we start with the first screen here. We've got our display. It tells us about this app. Now, important, we have our first question, which is to enter your email address. Now, you may not want to enter your email address. Let me tell you the pros, in which case you have to enter one, but you can enter complete junk email address, xyzabc@blah-blah-blah.com. If you enter an email address, the app at the end will give you the option of emailing your answers and the analysis to you, and you'll have it for your permanent records. If you enter a junk email address, it'll enter your information, not your name, no names are taken, not your user, not your computer address, none of that's recorded, but it will enter your answer, send your answers to a junk email address that goes, nowhere, blah, 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 .com. So why would you want to enter your email address, given that some of this information, like your earnings, are confidential? The answer is that if you have that record for yourself of the questions and answers, you'll have valuable information that you can use when talking to the plan if there's a disagreement about whether you qualify for coverage. You'll be able to say, well, I answered yes and no to these questions, but I do have this other issue. I do have, my birthday is such and such or so and so. And according to the unofficial tool, that means I should be considered under this other rule. Because the tool, as it goes along, this app, I call it a tool sometimes, this app will explain itself as it goes along and explain why we're asking each question. So the answers can be helpful to you in talking with the plan or with their partner called Via Benefits, this new company that they've engaged, if you do get into a disagreement with them over coverage. Now remember, this is an unofficial tool, but it's intended to give you more information and make it easier for you to deal in an informed way with the plan about the issue of coverage as we go into 2021. So big changes as of 2021. So I will enter my actual email address. To do that, I'll put my glasses on, pardon me. jh@jhandle.com. Okay, and again, do not be put off. You can enter a complete junk email address. You can even enter a junk email address, go all the way through it, and then go through it again with a real email address if you decide, I really do want to get the answers emailed to me. And I want you to understand that I'm not going to make any use of the emails that are entered. I'm not going to collect them on a list. I'm not going to send anything to them unless you request in the comments box that you want me to send you something. I'm not going to make any use of it, but I am able to see the email addresses. So I want full disclosure. I want you to understand there just is no way of giving people the option of getting this email to them without the Google Forms collecting the email addresses. And that's all explained here. If you want to be anonymous, enter a junk email. Okay, so we're going to enter a real email. Let's go on. Who is the author of this app? Well, I've already answered that for you, but there's more detail here, along with a headshot that, as you can see, is aspirational. It's a headshot from a number of years ago. Next. Now, you'll notice I clicked the next button. So for those of you who are not used to using Google Forms, next and back, these two buttons at the end of each question, and sometimes you'll have to scroll down to see them. Those are the only ways you should navigate. Do not use the back arrow or forward arrow or refresh button on your screen. You can see I'm pointing them now. Those buttons that come with the browser itself. If you do that, you'll be taken back to the very first page of the app and you'll have to start all over again. I don't have any control over that. That's just the way Google works. So stay up to date. This is a request that if you'd like, that you separately sign up on my newsletter list for email updates about entertainment union matters. I write for the Hollywood Reporter, and what I do on that email list is send out notices primarily about Hollywood Reporter pieces that I've written. Occasional other emails. I'm just basically just starting the email list. I had been using sending email to a much smaller group, and it's probably averages 2 emails a week at most. Now I'm going to click on that because I want you to see what happens when you click on a link, because there are various links in this questionnaire, like to the plan website and stuff, and I want you to see how that works and how to get back to the questionnaire without losing your place. So we click on this hwd.news link, and notice what happens up here. A new tab opens. And since I'm already signed up on my own newsletter, I immediately see this page on the newsletter. You would see a slightly different page welcoming you and asking if you want to sign up or if you want to see some articles first. And I've imported a lot of articles from the past into this, and there'll be new ones as well. Now, how do we get back to the newsletter? The answer is, now, I should say, if you're on a phone, I would recommend that you don't click onto any tab. out of any links the way we just did, because it's hard on a phone to find tabs and get back to your preceding tab. Okay, so on a phone, you should not click the way I just did. Just don't click. Really, it's much better to use this on a PC or a laptop, probably, or a tablet, because a tablet will have tabs up here. See this other tab, this first one says Unofficial SAG-AFTRA Health Plan Advisor. That's where we were. This new tab says HWD News. We're done looking at HWD News, so click the small X on HWD News. Don't click over here, that would close the whole browser. Just click on this tab. And voila, we're back right where we were. So, next. Are you a first-time user of this tool, of this app? If you are a first-time user, click yes, because there are some important information screens that come next, including screens that provide tips that most people, even who've been members of the plan, the health plan, and members of the union for many years, actually don't know. And some of these are tips that the plan does not have in their printed material. I've learned some interesting stuff from talking to members. I think it was Yogi Berra who said you can hear a lot just by listening, or something of that sort, and that's certainly true. But if you are going through this for a second time, say that you've gone through and you wanted to go through another time but give different answers to see what the results would be, then you could click the no, I've used this once before and I want to skip the explanatory pages. So we're going to say yes, this is our first time. And what do we have next? I can't read it so well without my glasses. Unofficial app, unofficial, unaffiliated app. Points out again that this is unofficial. We're not affiliated with any political faction, any party, any group. All of the groups, to my knowledge, have been promoting this app. I'm glad they have, because I want as many members as possible to hear about it. We click next. Some disclaimers. I am a lawyer, so there is some legal language here. It's not very complicated legal language, but it's just that by using this, you understand that I'm not providing legal advice to you, or financial or medical advice. And by the way, on the subject of medical, we don't ask any questions about medical conditions anywhere. We just ask about age and earnings and number of dependents and things of that sort. So do read this screen of disclaimers, and then we click next. Privacy policy, and this explains what I just explained to you about the email addresses. Next, the length. How long is this thing? You should allow, and it depends on the complexity of your answers and your situation, but you should allow about 30 minutes to go through this, potentially less, probably not more. I will tell you behind the scenes secret, there are a lot of screens in this app, but no one is going to see all of them, no one person, because the screens that you see are only the screens that relate to the answers that you give. So if you're under 65, you'll see certain screens. If you're over 65, you'll see other ones. Let's go next. Coverage help. Where can you go for help about coverage? Not me. I don't work for the plan. I don't work for the union. Please do not come to me asking for help with coverage. What I've done is translated what the plan sent you and some additional information from the plan booklets and some additional information from sources at the plan, and have translated that into an interactive tool. So if you need additional help, here is information about how to contact the plan or via benefits. But please, if you find any bugs in this app, as we say here, or if you have any feedback on our next screen here, bugs and feedback, here's my email address, and you'll see it later towards the end as well. Plus, there's a feedback box that you can fill in at the end. What does it say also? Also, if you have special circumstances that the app doesn't address, then please tell me about that, and I can consider enhancing the content. But we'll see that the app it deals with a lot. So navigation, again, back and next buttons, not the clicks, not the icons on the browser. So we're going to click next again. Performers. The app generally assumes that you're a performer, not a broadcast staff member or a roster artist or certain other categories. We ask about that explicitly in one or two places, but please do remember that some of the answers and some of the conclusions of the app may not be right for you. if you're not a performer. So again, broadcast staff, roster artist, staff member at the union or the plan, because they also have insurance from the plan itself. Those kinds of folks, unfortunately, we're not able to cover every circumstance. What next? Timing. Yes, this app was created in August of 2020 and is meant primarily to help you understand what your options are going into 2021. It does not deal with the question of, okay, what are my options in 2022 and 2023 and so forth. Some of your options will differ because there are certain transitional programs that the plan has implemented. And also remember, and this is a hard one to accept sometimes, but remember that healthcare rules can change essentially at any time with very short notice, as was the case in this instance. So even if right now your options in 2022 are X, Y, and Z, that could change depending upon the plan's financial circumstances and what the trustees decide. And I have no control over that. So we're looking at 2021 here as we use this app. Now we start with some explanatory screens. First, how do you get earned eligibility? How do you qualify for the plan? If you already know this from Plan 1 and from dealing with Plan 1 and Plan 2, then this will basically be familiar to you. Pardon me. But I was told, given feedback by some members, that many members don't know even the basics as of the way things work now, let alone the way things are changing. And so I've added some screens here that explain what every member should know about their health plan. I won't go into the details here. You can read them here. Earned eligibility, special circumstances for eligibility, covered earnings, non-covered earnings, eligibility days. You can qualify based on the number of days you worked in a period of time rather than your actual dollar earnings. Base earnings period. This can be a little complicated, so I'll say something about it, although you may be familiar with the concept. Let's suppose that the very first time that you qualified for SAG-AFTRA health insurance was that you made a bunch of money in the month of May. Doesn't matter what year, but it was May. That means that your base earnings period started in that year, your first base earnings period started in that year in April. Now, why in April? Because each base earnings period starts right when a calendar year quarter begins. The first quarter of the year is January, February, and March, from January 1st through March 31st. The second calendar year quarter is April 1st through June 30th. You earned money in this example in May. So your base earnings period starts April 1st. And guess what? Even though that might have been April 1st of 2018, April 1st of 1970, whatever it is, from then on, your base earnings period is a 12-month, is whatever the 12-month period is that starts with April 1st. So your most recent base earnings period, for example, given that it's August right now of 2020, your most recent base earnings period that was completed was April 1st of 2019 through March 31st of 2020. Right now, we're still in the middle of a base earnings period that's not yet completed for you because your base earnings period won't complete until the end of March. So again, a base earnings period can start on January 1st, can start on April 1st, can start on July 1st, or it can start on October 1st, and it runs for 12 months. Let's click next. A benefit period. A benefit period is also a 12-month period. And your benefit period initially starts 1 quarter after your first base earnings period. So the first time you made enough to qualify for health insurance was a period, in my example, that ran from April 1st through March 31st. The next quarter, April 1st and May and June, through the end of June, April 1st through June 30th, the plan looked at your earnings records and decided, yes, he or she or they earned enough to qualify, or no, they did not. That quarter lag is always the case going forward. It always takes them an extra quarter to determine whether you're eligible. But you won't have if you're eligible, you don't have gaps in your coverage, because your coverage is continuing during that time period where they're making a decision. That's complicated. The best thing to do is to log on to the plan, and I believe there's a portal that you can log on to, and I'm going to add the email address. And you can find out what is my base earnings period, what is my next benefit period, and things of that sort. I don't have access to any personal information about you except what you answer in the Q&A, so I don't know the answers to those questions. Now, here is a table that shows you how base earnings periods and the determination date, where they're determining if you're eligible or not, and the benefit period relate to each other. Let's move on. COBRA. You've heard the term COBRA many times. It's a federal law, or set of federal laws, that allow you under certain circumstances to continue your health coverage for a certain period, even though you're no longer eligible for the plan. Now, the downside of COBRA is that COBRA normally requires that you pay not only the premiums that you've been paying, but the amount by which the plan has been subsidizing your coverage, so-called full COBRA or unreduced COBRA premium level. That can be very expensive. Now, at the end of this app, I will show you ways in which certain people may be able to get even full premium COBRA, get the premiums paid for by the state government. That's only the case for certain categories of disease, frankly. But I will also show you as we go through this, in fact, I'll show you on the next screen, that the plan has instituted 2 forms of reduced price COBRA, where you pay 20% of the COBRA premium instead of the whole COBRA premium. What that translates into is that as an individual, you would pay about 1.5 times what the individual premium is. Instead of $125 a month, you'd be paying about $180 or $185 or so. For some people, that extra $60 may be difficult to afford. For others, though, it may not be that much of a problem. And so I want you to be very aware that you may have that option. For individuals with dependents and individuals with 2 or more dependents, the reduced price COBRA is still 20% of the full COBRA, but it translates into almost twice the premium that you would otherwise pay. That may still be a good option for you. Not as pleasant an option, obviously, as paying the regular premium, but it still may be an accessible option for you. So again, let's pay close attention to the options. So as I say in this next screen here, there are 3 COBRA programs, and I summarize them. Senior citizens. I want you to be aware, the plan doesn't use the term senior citizens, which is why I use that as the heading, because the plan uses 2 terms, retirees and senior performers. And they have different meanings. A retiree is not necessarily a senior performer. A senior performer is a subset or subcategory of retiree. If you answer that you're 65 or older, as we go through the Q&A, you'll get more information about that. Life events, if you have a birth, a divorce, a death, a dependent who turns 26, various other events, you should be aware that you need to notify the plan. Some of these may trigger coverage, some may trigger loss of coverage, dependent turning 26, for example. But these are things that can change your insurance and change your insurance options. Sessional earnings, session fees. Just want to emphasize that this term, as used by the plan, doesn't just mean, say, a voice artist going into a studio and doing a session. It includes any work that any performer does on location, on a studio lot, from home these days, from a home studio. Any of that is session earnings. What's not session earnings is residuals, and that's really the distinction that's intended here. Residuals, and I think most of you know what residuals are, but there's discussion of that here as well. And now we get to the Q&A. Are we under 65 or 65 or older? I'm under 65, so we'll go through this once, answering as it is for me, and then we'll try another route as well. Okay, am I on Medicare or taking a SAG-AFTRA pension? No. In fact, I'm not a SAG-AFTRA member, but we'll leave that aside. We'll pretend that I am. Did I make over $25,950 or under? $25,950 or over or under, and including session and residuals. Now, there's been a lot of misinformation out there that residuals no longer count. That's true only under some circumstances. And in fact, residuals under those particular circumstances that relate to some seniors, not all, but some senior citizens, that was true prior to 1917. It's true prior to 2017 as well. But in 2017, when the SAG and AFTRA health plans merged, residuals were allowed to count under more circumstances than they do now. But we're under 65, session and residual earnings count. And let's say that I made over $25,950. Congratulations, I appear to be eligible for the SAG-AFTRA health plan. Okay, what we get next is some important further information. First of all, how long will my coverage be? It'll be 12 months of coverage. It'll be a benefit period. The plan premiums, and here they are. So for an individual, $375 a quarter, which I translated a moment ago into $125 per month in that example I was giving. By the way, COBRA premiums are paid on a monthly basis. Plan premiums are paid on a quarterly basis. Benefits. If you understand the benefits under the existing plan, we can move on. If you don't, I would urge you to click these various links here to understand the benefits under the existing Plan 1, and then we will get to how the new plan has changed from Plan 1. Plan changes. There's a working spouse rule, which we'll get to on the next few pages if you have a spouse. There are various other changes. We click next. Are we married? I'm not, but let's say that I am. If I am, here's the working spouse rule, including a link for more information. Then we go on to what we'd see either way, whether I was married or not. Other sources of coverage. Now, I want you to know as much as possible about your other options. Many of these are in the material that the plan provided or on the plan website. Some of these are not. And I'll flag in particular a couple that are not. Okay, other sources of coverage. Social safety net, Medicare. If you're approaching age 65, you need to learn about Medicare and enroll. If you enroll late, it's not a plan rule, it's a government rule. If you enroll late, your Medicare premiums are liable to be, for the rest of your life, to be higher than they would have been otherwise. So it's very important. Once you turn, put it this way, once you turn age 64, learn about Medicare, learn about the deadlines. Medicaid, Medi-Cal, Children's Health Insurance Program, Obamacare, also known as ACA, the Affordable Care Act, covered California, in California, and I've given you some links here for that, and for California, New York, and other states. Now, some information in the plan that's not in the plan materials. If you're HIV positive, depending on the state you live in, there may be a program, and in California there is a program that will pay depending on income, and all of your plan premiums, and all of your plan co-pays for outpatient, all of your plan co-insurance for outpatient, all of your HIV prescription drugs, and certain of your non-HIV prescription drugs. And when I say all outpatient, I mean outpatient related to anything, not just related to HIV. The earnings threshold is actually rather high. It's 5 times, you qualify if you make between 130% of the poverty line and five times the federal poverty line, which is about $64,000 in adjusted gross income. And adjusted gross income, if you have independent contractor income, you can take deductions off that income before you get to AGI on your tax form. So you should, if you are HIV positive, I would urge you to click through the resources that are here. Many people do not know about these resources, and they're basically the government, in the Reagan years, SAG President Reagan, President of the United States Reagan, was very anti-gay and was very opposed to helping people with HIV at all. The pendulum swung, and the Ryan White Care Act, I probably have the name slightly messed up, but it was named for Ryan White, a considered a more sympathetic victim of, or person with HIV and with AIDS, because he was a kid. That act that Congress passed funds programs like this, and the state of California is particularly generous, but other states have programs as well, and I've given you multiple links here. From Googling, I found out that people with kidney failure have a program that may pay their health insurance premiums. So again, even if your only option is full-priced COBRA, you may end up getting those premiums paid by the state government. So check these last 2 pages if they apply to you. For more help, some of this information was provided by the plan. Some of it is additional information, this last link in particular. And a reminder, and thank you. If you want to help your fellow members and you found the tool useful, you can click either of these links to generate a tweet or a Facebook post that you can edit before posting it. I would request and urge that you do, so that more members learn about the tool. You'll see, let's see here what happens. We click the tweet and click to tweet, blah, blah, blah. Here we are, SAG-AFTRA members. And here's a pre-populated tweet that you can change as you wish, and you click tweet and it will get sent. Here with generating a Facebook post. And you can add some text up here if you want, and then click post to Facebook. Please close this tab to continue. We close the tab, we're back where we were. We click next. Give it a rating. I'm going to rate it a 5, thank you. You can enter your comments here if you want, that's optional. Click next. Now, very important, if you want a copy of your responses and the analysis, in other words, all the screens that you saw, click this little slider. You see how it turned on. Then you click submit, and we're done.